and I'm here today with Matthew. For the past 2 days, we did 2 guided smile chrome double arches. So Matthew, thanks for having me over. I appreciate it.
Thank you for coming.
Montana is awesome. Love your office. Your staff is great.
Thank you.
And just tell me a couple of words. How was your experience with the system? And just kind of elaborate what your thoughts are about that.
Yeah.
Please.
Honestly, it was a really good experience. This was the second time we've had a tech out. Thomas, he's kind of our favorite. They're all great, but he just had a lot of really good tips and tricks. Specifically with the system, though, the thing I love about Chrome so much is just for sure that as long as you follow the rules, things are going to go where they need to go. You're going to get the best restorative outcome. You're not going to have not enough material thickness in the end. Prevent breakages long term. It's going to hold up better. Implants are going to be around bone where they need to be, but yeah, it makes sense. This is the kind of thing that I have done full arch surgeries myself, taking some courses by a couple other clinicians that teach this stuff, but ultimately having the experience of Liz. I've really enjoyed working with her. They're great technicians to really do a lot of the work for you. Obviously you're going to have a meeting with them and make sure that things are where you want them to be restoratively, but they're the ones making the guides, and these resin guides they're good. I've made them before. They can work, but they can break, they can flex a little bit, and so having the ability to stack these guides and to have them in metal chrome, it just provides a lot of stability, a lot of peace of mind for me. It might take a little bit longer to do the guided versus a free hand, but for me, the patient's paying enough money, and you want this to last as long as it can for the patient, and so it makes a whole lot of sense. And I feel like Chrome for our practice really fits really well with kind of the goals that I'm trying to achieve for my patients.
Excellent. So yesterday you did a tooth supported guide, Chrome, double arch. We had to do some extractions. You used Neodent as your restorative implant system. And this morning, you did a edentulous double arch. What was your experience with the tooth-supported guide and the accuracy with that tooth-supported guide as it pertains to Chrome?
With the tooth-supported guide, it was awesome. I mean, her teeth were really pretty stable. There wasn't much mobility, and so yeah, we were able to dial in things really well. She had actually some pretty thin bone in some areas, and so we kind of really were able to thread the needle. I think for her it worked out really well.
And then what did you do yesterday that you were kind of ecstatic about on the lower arch?
With the lower arch?
When you did your reduction.
Oh, yes, thank you. I've just seen some colleagues of mine that when they go ahead to do the bone reduction, that they just leave the teeth in. They just take a 57. You got to have the right kind of drill, right? But you can just mow through that whole thing in one solid piece and take it out. And picking out those root tips too at the very bottom, they were like 1 to 3 millimeters. They were super easy. It just made me question why you would ever do it different any other time.
Excellent, excellent. And then this morning with the edentulous arch, the protocols are a little different with pinning the guide and getting it situated and the outcome. What was your experience with the edentulous protocols?
The edentulous protocols, I think still yet they're the best they can be. There can be a little bit of play, obviously, because it's tissue borne. That was my second case that I've done with Chrome. The very first was my third all in all. The very first one I did was the same as the one we just did, right. Both edentulous. And so overall, both worked really well. Maybe a little bit of play in the end result on both, with maybe the occlusal plane just being very, very slightly high in the back. We were able to dial that in really effectively. But honestly, just doing that freehand, I really like the confidence that doing it guided gives me. So.
Awesome. Matthew, thank you for having us, and we look forward to working with you in the future, and enjoy the rest of the year.
Thank you, Thomas. It was a real treat. Thank you so much.